When was the last time you checked your blood sugar level? You can have high blood sugar level without even knowing. No obvious symptoms, no signs, no pain, and you feel completely normal. What is high blood sugar level? And also, why is it important for you to know your numbers? The numbers is what? The range of the value that you see, and you know that okay, it's completely normal. We have what to call fasting blood sugar, and we also have random blood sugar. So your fasting blood sugar, this is blood sugar when you just wake up or when you have not eaten for a long period of time and it's mostly over the night. While the random blood sugar, this is the blood sugar level that you get during the daytime after you have eaten some kind of things or had anything. So randomly, what are now like the level of your blood sugar? That's what we call random blood sugar. And the normal range for fasting blood sugar is 3.5 millimole to 5.5 millimole. While the normal range for random blood sugar is 5.6 millimole to 7.8 millimole. So what is blood sugar? Blood sugar, as we all know, is what? Blood glucose. When you take anything, the body converts it to glucose, and this glucose is a way in which that the body is going to utilize it to produce energy. So in a situation whereby the body is not utilizing it, that's where deficiency comes in place. The hormone that is necessary to make this happen is insulin and glucagon. Most importantly, insulin. Insulin, when the body converts the food that we take into glucose, then the insulin is going to take the glucose into the body tissue and cell where to be utilized to produce energy for the body functioning. So what can happen whereby your insulin level is going to be reduced or not plenty anymore? This is where we have type 1 diabetes, type 2 diabetes. Type 1 diabetes, this is an immune system disorder whereby the immune is just going to be breaking or damaging or destroying rather the pancreatic cell, because it's the beta cell that is being involved in production of insulin. So it's going to just damage the pancreatic cell, whereby when the pancreatic cells are damaged, the beta cells are no longer there, then insulin is not being produced. And if insulin is not being produced, then the mechanism for the conversion of glucose into the bloodstream and also into the tissue is going to be distorted. Also, another one is that type 2 diabetes. This is when the insulin level just automatically go down or gradually it just goes down. Another reason why we will have a low insulin level is also hereditary. This is being passed from parents to offspring. It can be passed from parents to offspring because there are some cells or some disorders whereby the pancreas is going to be damaged, and we don't really know what's going on inside our body. If we have like a hereditary condition, we don't really know which one you have or which one you don't know, you don't have rather. So why is our sugar level very important? It's what you eat is very important. And also symptoms that can occur is that you'll be feeling excessive thirst, frequent urination, increased hunger, and also unexplained weight changes. Excessive thirst in the sense that you'll be very thirsty, frequent urination, and unexplained hunger. Imagine whereby your body, the normal mechanism is that you'll be having you need glucose for the body to function quite alright, but then this glucose is not entering into the tissue, it's not entering into the cells, it's not going where it's supposed to go to. It's just being accumulated in the bloodstream, making just the blood sugar level being elevated. So what really happens is that the body is not utilizing it, and that's going to bring a symptom of what we call weakness. The body is not getting it, it's just there, then you will be weak. Unexplained weight changes, the body is not getting it, the weight of that person will be going down. Also, diabetes, there is more to diabetes. It's not just about what you experience. There are different organs that are being affected. Organs that are being affected is what? The heart, the eyes, the kidneys. If the kidneys are affected, is what we call diabetic nephropathy. If the eyes are being affected, this is what we call diabetic retinopathy. Why if the nerve cells or the blood vessels are being affected, this is what we call diabetic neuropathy. All these are very important. So what happens in diabetic retinopathy? Diabetic retinopathy, this is what happens when the eyes is being deprived of oxygen and blood flow. So what diabetes really causes is that diabetes causes damage of blood vessels. These blood vessels, because that there's increased glucose level in the bloodstream, so the endothelium of the blood vessels is going to damage. They are going to be debrided. When they are debrided, by so doing, there is damage to that and there is scarring to that. This scarring now is going to distort the blood flow. When blood flow is distorted, then oxygen also is being distorted, because hemoglobin is in the blood that carries oxygen. When oxygen is not going to the eyes, so there are tiny blood vessels in the eyes. These tiny blood vessels now, they now undergo a lot of strain, they undergo a lot of stress, because they are trying to keep the eyes moving, they are trying to keep the normal physiology of the eyes, and by so doing, they are now going to undergo a lot of stress, and this lot of stress now will now cause damage to the blood vessels and damage to the vessel. So when they are damaged, oxygen is not going there, so that's why you have blood vision in diabetes, and over time this blood vision is going to lead to blindness. That's why you see that cataract is very peculiar in diabetes and is a result of diabetic retinopathy. Also, we have what we call diabetic neuropathy. Diabetic neuropathy, now this is where the nerve cells are being damaged. This damage to vessels also damage nerve cells. Whenever you have tingling sensation, that's why you see that diabetic patients, they are not really feeling their body, because it's going to get to a period of time whereby they will no longer feel their body parts. If they're not feeling their body part, that means their nerves are being damaged. When this nerves is now damaged, then that's why they are having tingling sensation. Something will be happening to them and they will not feel it, because it's nerve that is going to help us know to know what's going on. So those electrical impulses is not being transmitted, and they will not feel it. Even when they have a wound or when they have anything, nothing, they will not feel it until when the damage is being caused. And why they also have diabetic neuropathy also. This diabetic neuropathy, it also results in what we call diabetic foot. Diabetic foot, in the sense that there is now damage or there is a particular injury to their body parts. Their nerves are not sensing it. They are not feeling any sensation. So when they are not feeling that sensation, by so doing, blood is not going there, oxygen is not going there, the wound is going to take a lot of time to heal. And when it's going to take a lot of time to heal, instead of it to get better, it's going to be getting worse, because the necessary things needed for wound healing to occur is being distorted. That's why they end up amputating their leg or end up amputating their body parts, because of a lot of damage that is going to cause. Another thing that happens is what we call diabetic nephropathy. Diabetic nephropathy, it happens in the kidney. It just like the process of diabetic retinopathy, which is the eye. The kidney now, they need oxygen, they need blood to be able to function well. So since they are not really getting what they need because of the distorted or damaged blood vessels that diabetes cause, so there will now be a lot of stress on them, and the kidney just stop functioning very well. All the normal physiology that is going on is going to now be distorted. When it is distorted, then the normal process that of filtering blood to produce urine is going to be altered, and by so you'll be seeing frequent urination. That's why they always have frequent urination, and this frequent urination, you will also see glucose in their urine, because the glucose is not filtered properly. We have to take care of our health. Don't wait until when there's an emergency before you take care of your health. Know your blood glucose level today. Save yourself, protect yourself, and also protect your future. Thank you. Do well to follow, like, and subscribe.